joined by Brian Leedman, Director of OncoSil Medical. Brian, thanks for your time.
David, thanks for having me.
OncoSil Medical, what attracted you to it and how big's the prize?
Well, OncoSil Medical is a company that I co-founded about 8 years ago as a spin-out of a company called Cyvita Corporation, who I worked for a decade out of Perth. And I just thought it was a terrific opportunity to take this oncology asset that Cyvita was no longer pursuing and create a new co out of it. And we actually backdoored that company into a shell, which became OncoSil Medical. And I think I spent years promoting this company around the world and this novel way of treating a solid tumour in the pancreas, and I thought, what a great opportunity to come back and start that all over again.
And the technology has significantly advanced over the last 8 years?
Yeah, certainly. OncoSil used to be called BrachySil back in the Cyvita days. It was only in a phase 2 clinical trial. In the years that that's taken over the course of OncoSil Medical, since I think it listed about 8 years ago now, is that it's now got CE mark approval in Europe. They completed all their clinical trials. The efficacy results were terrific and it was deemed to be safe. So it's actually achieved a great deal and it's all about commercialisation now.
And what is the path to commercialisation?
Well, first of all, you've got to get a regulatory approval, which we've now achieved in Europe with the CE mark, and now it's adoption by hospitals in different jurisdictions within the European Union. So in Germany, there's a number of programs that are starting with adoption at various hospitals. There's 25 hospitals signed up for that. Plus there's also another study being done in Germany, which is actually to get healthcare reimbursement in Germany. And most notably, and very recently, the United Kingdom has approved for private healthcare reimbursement, which is something just happened some weeks ago.
And is it a competitive space?
No, not particularly. The field of medicine is called brachytherapy, and that's basically using radioactive particles that are somehow delivered within your body and targeting tumours. If you think about a company like Certex that was approved some years ago, also came out of Perth, which is where OncoSil came out of, that technology actually gets sucked into tumours via a blood vessel via your groin. And so it works on the principle that tumours are thirsty and they want to grow faster. That's one way of delivering a radio-targeted type therapy, but in OncoSil's case, it's actually delivered very targeted via needle directly into the pancreas tumour. So it's a far more localised way of treating solid tumours.
You've just come off the back of a fantastic success with ResApp. Why OncoSil and why now?
Well, the chairman of OncoSil is a guy called Otto Batula. And Otto was a very successful businessman, a very wealthy businessman, and he backs companies that he invests in, and he came on and joined the board as chairman. And I've known Otto for some years, and he asked me, what am I going to do after ResApp gets acquired by Pfizer? And this was back in July, and I thought, I'm not really sure yet. I haven't really thought that far. And he asked me to join the board of OncoSil, and I thought, you know what, that's a great idea. I actually had a hand in creating this company. I also was keen to work with Otto. And I think that the company's extremely promotable, and I'm very attracted to companies that I think are promotable.
And where to from here?
Well, certainly for me, its focus is on OncoSil, and I think that this company has lacked a lot of investor relations type activity. There hasn't been many presentations made at investor conferences, and I thought immediately one area that I could add value for OncoSil was actually to be proactive and attend conferences like this one at TechKnow Invest, which I presented at for other companies over many years. And I thought, this is a great story, someone needs to go out and tell it. I'm not a scientist, I'm certainly not going to progress the technology, that's for others to do, but I'm out there to tell a good story, and I love it when I get surrounded by potential investors after a company presentation and get to talk about something that I love.
A great company, doing amazing things, well on the path to commercialisation. Exciting times ahead for OncoSil and its shareholders. Brian, thanks for your time.
Thank you.